It's estimated that there are about 7,000 chemicals in tobacco smoke, and at least 70 of them are known to cause cancer. Some of the chemicals that are found in combustible cigarettes can be seen in the slide right here. Another common product that many of your patients might be using are electronic cigarettes. E-cigarettes do not contain tobacco. Instead, they contain a heating device that turns an e-liquid into an aerosol. This e-liquid contains nicotine, chemicals, and flavors. They can deliver cannabis and other non-nicotine aerosols. As you can see, e-cigarettes come in different shapes and sizes, as well as different names. They have a very high nicotine content, which can make it particularly difficult for someone who's trying to quit. Just to help contextualize it, a single device can contain the same amount of nicotine as 20 to 30 combustible cigarettes. But why is nicotine so harmful? Well, we know that nicotine fuels tobacco addiction. Most tobacco users become addicted to nicotine, a drug that is found naturally in tobacco. The way that nicotine is delivered to the brain, it's very, very quick, about 7 to 10 seconds, and it gives users a feel-good euphoric sensation. But once those nicotine levels drop, the urge to smoke begins again, and the harmful cycle of nicotine addiction recommences. Quitting tobacco is hard and does require several attempts. People who stop tobacco often start again because of withdrawal symptoms that include stress and weight gain. It's worth noting that more people in the United States are addicted to nicotine compared to any other drug. And the reason so many people have difficulty quitting is because of the withdrawal symptoms that come from nicotine. Nicotine withdrawal can cause many affects such as irritability, anxiety, difficulty concentrating, restlessness, depression, insomnia, impaired performance, weight gain, and cravings. The good news is, though, is that there are many ways that you as a healthcare provider can manage these symptoms and ultimately help your patients on their quit journey. So now let's talk about the 5 A's, an evidence-based tobacco cessation intervention. So the 5 A's is an evidence-based tobacco cessation intervention developed by the U.S. Public Health Service. It was designed for healthcare providers to assist their patients who want to stop using tobacco products successfully. As a healthcare provider, they list that you should be following these 5 steps when addressing tobacco use among your patients. As a physician, you should ask your patient about their tobacco use and identify and document their status in their patient chart. If they say they smoke, you should advise in a clear, strong, personalized manner that they should quit. Once you've advised your patient to quit, you should also determine if your patient is willing to change their smoking habits. If they are willing to change, then you should support your patient in treating their tobacco dependence by offering medication and counseling. Once you've assisted your patient with this, you should arrange and schedule any follow-up appointments to discuss any challenges or barriers that the patient might face on this quit attempt. Today, we're specifically going to focus on the assist piece so that you can effectively learn how to support your patients with medication and counseling. So assisting a patient in treating tobacco dependence is a 2-part process. Like I mentioned, this is a 2-part process. When you smoke or you're addicted to nicotine, you have the physiological effects of being addicted to the nicotine, but then also the behavioral habits of using tobacco. The most effective way to treat your patients is to encourage them to both address the physiological and the behavioral aspects of tobacco dependence. To do this, you should encourage them to utilize both medications for cessation, as well as enter some type of behavior change program. As a provider, your goal is to connect clients to treatment options that include medication and behavior change programs. So now let's talk a little bit about that kind of medication. So before we go into a deeper dive on the different types of medications that exist, it is important to understand why you should encourage your patients to look at nicotine replacement therapies and pharmacotherapy. First of all, countless studies demonstrate that using these medications actually improves your chances of successfully quitting. These medications are designed to make individuals more comfortable while quitting, and by being more comfortable while quitting, it can allow them to focus on changing their behaviors, which is, the behavior of smoking. These medications don't contain the harmful toxins that, say, cigarettes or tobacco products might have, and it's important, that these be things that you consider when prescribing medications with your clients. So let's talk about the medications. There are 7 FDA-approved tobacco cessation medications. 4 are prescription, which are the 4 above, which include varenicline, also known as Chantix, bupropion, the nicotine nasal spray, and the nicotine inhaler. Then there are the over-the-counter nicotine replacement therapies that include the gum, the lozenge, and the patch. At the end of the session, we have different printed materials that you can find on your way at the tables in the front that include different resources. This pocket guide, which is how to use tobacco treatment medications and how can I get tobacco treatment medications, are both really helpful guides to show you how you can get those medications for free for your patients. So the first medication we're going to discuss is varenicline. Varenicline, also known as Chantix, is considered the most effective form of pharmacotherapy according to many studies. The reason is because it reduces the amount of physical and mental pleasure received from tobacco. It's dosed in graduating strengths, and it's important to note that it is the only NRT that is recommended to not use with other nicotine replacement therapies. It typically is recommended to be used over a 12-week span, but it can be extended for clients who successfully quit so that they can boost their chances of remaining smoke-free. Bupropion is another medication that can help support tobacco cessation. It can be used alone or in combination with other nicotine replacement therapies. It is really helpful as well for people who have depression because it also can act as an antidepressant. Next, let's talk about the nicotine inhaler. So when someone has the urge to smoke, it is recommended that they use the nicotine inhaler. It contains a mouthpiece and a cartridge, and the nicotine is absorbed through the lining of the mouth. A lot of people like this specific nicotine replacement therapy because it can mimic the action of smoking, and people can take as many or as few puffs as needed to control their urges. It is only available through prescription, and it is worth mentioning that at this time, this product has been discontinued due to the unavailability of the mouthpiece. Similarly, the nicotine nasal spray is recommended to help control urges to smoke. The nasal spray is also prescription and is great because it absorbs faster than the nicotine gum, the lozenge, or the inhalers to help with cravings. There are about 100 doses per bottle, but can cause some side effects such as sneezing or runny nose or sore throat. It's worth mentioning again that there is a higher liability for abuse for the nicotine nasal spray, so it should be something to discuss when you are consulting with your patients. So now we're going to transition into some of the more popular over-the-counter nicotine replacement therapies. The most popular one is the nicotine patch, which is considered a long-acting form of nicotine replacement therapies because it slowly replaces a steady dose of nicotine over 24 hours. It is applied to the skin and then absorbed. It can take up to 6 hours for someone to reach the peak nicotine levels, and it is recommended that it be placed above the waist in an area on the skin that doesn't have hair. It is not recommended that you cut the patch in half, and it should be reapplied every 24 hours. Like all medications, it can include some side effects like headaches, nausea, dizziness, and skin irritation. The nicotine gum is another popular form of short-acting NRTs. It's not chewed like the regular gum. You chew it, and then you let it soften, and then you place it in between your cheek and gum. You should park it there until some tingling has faded, then recommence chewing it until you feel tingling again, and then park it in another spot. This should be repeated for about 30 minutes until all the gum has been thoroughly chewed and all the nicotine has been released. There are two strengths depending on someone's level of nicotine dependence, and there are many different flavors that could appeal to patients. The lozenge is also a short-acting form of NRT, and it is absorbed through the lining of the mouth. It should be placed like the gum in between the gum and the cheek, and then absorbed until it dissolves fully. There are two strengths and different flavors, so again, depending on what your patient might like better, and it can cause some irritation and dryness in mouth and throat. So many people in the past had questions about continuing to smoke while using nicotine replacement therapies. About 10 years ago, there were warnings that you shouldn't. Back in 2013, though, the FDA actually reversed this and removed these safety warnings because after reviewing research, they concluded that over-the-counter nicotine replacement products with cigarettes or other nicotine-containing products did not raise significant safety concerns. So using NRT while smoking can be a harm reduction approach and help reduce the amount that people are actually smoking. So before we go into the counseling section of the training, I just wanted to quickly pause here to see if anyone had any questions about the medications or about the different tobacco products that we've discussed so far. Great. So I'll pass it on to my colleague Jackie to kick us off.
Got to adjust the mic a little bit. Okay, great. So now that you've been working with your patients and you've provided them with medication or information on how to get some type of medication, the next step is to use counseling techniques to get them to address those behavioral components. Okay, so there's three pieces to this counseling piece. So first, as a healthcare provider, you can use different counseling techniques like motivational interviewing to help encourage them to quit or reduce the amount that they are smoking. It's interesting to note that as a healthcare provider, you can actually bill for counseling for tobacco cessation. We'll provide more information later on. So once you've counseled them, you should encourage them to attend some type of behavior change program. So on the back table, New York City Department of Health put a really helpful guide to smoking treatment programs in New York City. Those have treatment programs all throughout the city, and it's actually exciting. New York City Health and Hospitals, Kings County, which I understand is right across the street, actually has a free tobacco cessation or tobacco treatment program that people can attend. So that's a great option for referral. And then finally, we encourage you to use additional referral resources, such as the New York State Smokers Quit Line or the Asian Smokers Quit Line. As I mentioned, you can bill for counseling. So there's two types of counseling you can bill for. One is for up to 3 minutes, and then it's from 3 to 10 minutes. And then I actually think there's over 10 minutes. So there's different billing codes you can use. New York City and New York State Department of Health have these great guides, which we can share with you if that's something that you would like to learn more about. I also just want to mention the New York State Smokers Quit Line is a really great resource. So New York State Smokers Quit Line offers coaching by trained tobacco dependence treatment specialists. So anybody who calls or is referred there, they'll get a phone call from the Quit Line, and people will receive up to 2 counseling sessions to help walk through their quit or reduction of tobacco. If you are someone who reports having psychological distress, alcohol or cannabis use, disabilities, and pregnancy, they will actually offer up to 5 counseling sessions to those who report that. They will also refer you to additional services in your area, such as some of those tobacco treatment programs. In addition, the New York State Smokers Quit line will provide free nicotine replacement therapy. So if you qualify, you will receive a patch and potentially lozenges or gum if you're a moderate to heavy user, and you'll receive a lower dose of the patch if you're a lighter user. It's also important to note that they do have text messaging services for teens and adults, especially to help them quit vaping. So let's do a little bit of a deeper dive into using motivational interviewing. So what is motivational interviewing? It's a technique and a collaborative conversation style for strengthening a person's own motivation and commitment to change. So there's 4 steps when you're having a conversation with someone and using motivational interviewing. So the first step is you want to engage with them. You want to develop a very positive relationship so they'll feel open and comfortable expanding and talking about something they would be interested in changing. Then you want to focus and agree on a shared purpose. So in this context, it could be quitting or reducing the amount they smoke, but you actually could use these techniques in honestly anything you're working with clients on, so that's really important to note. After you've agreed on that shared purpose, you evoke and explore why the client is interested in addressing that behavior, in this case, quitting smoking. And then finally, you help plan. So you work up with them to develop a plan to help them quit or reduce the amount they're smoking. So there are 4 different skills when you're having conversations with motivational interviewing. So these are open-ended questions, affirmations, reflective listening, and summarizing. So open-ended questions can really help a session feel less like an interview and more like a conversation. And when you're speaking with people, asking 2 to 3 open-ended questions can really make someone feel more comfortable, and it can reveal a lot of information. These open-ended questions can also evoke change talk. So an example of a closed-ended question would be, have you quit tobacco before? They might say yes or no, but you could say, tell me about your quit attempts. So not only will you learn about how whether they've been able to quit, but you also might learn why they weren't successful and help them address it later. Another example of a closed-ended question would be, have you attended group sessions? An open-ended question could be, in what ways have the group sessions been helpful to you? So you can learn what is really helping them and help encourage them to continue pursuing that in their quit attempt. Affirmations are a statement of understanding and appreciation for something someone has tried, done, or achieved. So this is being genuine and honest, as well as positive and encouraging. By using affirmations, you're making someone feel recognized and really good, and you're recognizing specifically efforts, experiences, and feelings. It also helps you build rapport. So if someone says to you, I tried quitting last week, and I got through 2 days, but then I relapsed. You can say, it's amazing that you got through 2 days. What worked well for you? So by affirming them, you're encouraging them, you're motivating them, you're reminding them that they can do it, increasing self-efficacy, and it also opens up a conversation about how they can continue exploring quitting or reducing the amount they smoke. Reflective listening. So it's listening and understanding what a patient is saying. By using reflective listening, you're demonstrating that you've accurately heard a client, and this also can strengthen your relationship. It encourages further discussion and facilitates change. So this reflective listening is repeating, rephrasing, and paraphrasing something someone says. So in this case, a client says to you, I just don't want to use NRT. I should really be able to quit cold turkey. You're inferring, and you respond to them, you don't want to rely on a drug to quit tobacco. That's something you then can explore with them to understand why they might not want to, talk about different options, etc. And finally, summarizing. So at the end of a conversation, you want to summarize what happened, and it should really be strategic. So you want to pick out things that have been helpful, and what information should be left out, you can leave out. You also can consider using additional information during a summary from past conversations or visits, etc. So to start a summarizing sentence, you would say, I want to make sure I'm understanding what you're trying to tell me. What you're saying is, or let me make sure I understand you. So again, you're using all 4 of those techniques in each of the different steps of the motivational interviewing process when you're engaging, focusing, evoking, and planning. So what does this look like in practice? It's always so easy to say, have a conversation, use motivational interviewing, but these are some of the actual language you can use as you're going through this. So what I just want to note is that making a change can be quitting, or it can just be reducing the amount someone smokes. You really need to meet someone where they're at and do what's right for them, because that will be ultimately the healthiest and most harm reduction approach you can use. So if someone smokes, 2 packs a day, they might be really overwhelmed by quitting entirely. It would be amazing if you could get them to smoke 1 pack a day and then eventually work with them to continue quitting. So when you first engage with someone, you can say, are you thinking about making a change in your current smoking habits? If they say yes, you can say, would you be comfortable if we explore that more together? And if they say yes, then you can proceed. And if they say no, you can encourage them to talk about it another time. But if they say, no, I'm not thinking about making a change in my smoking habits, you could say, I definitely hear that you're not interested in changing your smoking habits. Is it okay if we talk more about that? And if they say yes, that's great, then you can continue the conversation. But if they say no, you can talk about it another time. And again, you want to meet people where they're at. You don't want to be so pushy that they no longer want to talk to you as their healthcare provider. So it's really about finding a balance and meeting them where they're at. So if people are interested in having the conversation, you then ask some questions to evoke more information, which will then help you determine ways to help them quit. So you could ask questions like, what do you enjoy about smoking? In what ways is it helpful to you? And then you can think about ways that you could replace some of those things with healthier habits. What are some ways that smoking might be holding you back in terms of things you want in your life, like relationships, health, money, recreation, or other activities that are important to you? What do you know about withdrawing from nicotine? What have you heard about using NRT to manage cravings when you're in places where you can't smoke? What are you interested in learning more about? Would you like to discuss ways to manage your withdrawal symptoms? So as you kind of have this conversation, you can then start to plan. You would summarize everything that had been discussed, and then you can say something like, based on everything we've discussed, what would you like to do next? And if they're interested, you can help them develop a quit plan, like getting them on medication and counseling, etc. A lot of times people get concerned about addressing pushback. So people might be really sensitive about their smoking habits. So what's really important when addressing pushback is to express empathy and understand where the patient is coming from. Focus on reflective listening and summarizing. Support self-efficacy, so making sure they know that it's their decision, and again, meet people where they're at, and avoid arguing or persuading, because the whole goal of motivational interviewing is for people to get themselves to feel like they should quit themselves, not have someone telling them what to do. You're evoking change talk within them, so by arguing or persuading them, it's not going to be as effective. So, for example, if a patient says, well, you've never smoked, how would you know what this is like? You could say something like, you're right. I don't know firsthand, but from what I've been hearing, it's been really difficult for you. I have tools to support you to make it a bit easier, which have worked for other patients in a similar position. But ultimately, it's up to you. Would you like to hear more about some things people can do to help them quit? And then you would go from there. So we're going to do a little bit of a case study. So would love some of your answers to this. So we have Christine. She's 62 years old. She was seen at an annual physical with a primary care provider. She has a tobacco history. She's been smoking for 30 years. It started as a social behavior, but now it acts as a coping mechanism. She smokes about 20 cigarettes a day and smokes within 1 hour of waking up. She has never attempted to quit, and she's hesitant because she doesn't know where to start and is scared of the side effects. But also, she understands that it's something she needs to work on. She has a medical history of coronary heart disease. She has a social history. She's married and lives with her husband. She spends time with family and more recently her young grandchildren. She's relatively active. She goes for walks 1 to 2 times a week. She has to be in the office for work 3 days a week. Smoking is not permitted in her office, so she has to leave and smoke outside. She does not use drugs, and she drinks 3 to 4 times a week. Her motivation to quit is that she wants to be able to spend time with her family and go to work without having to step away to smoke, and just for her overall health. But she's mentioned 4 triggers, which are social events, alcohol, stress, and that it's just part of her routine. So as your patient, how might you treat Christine for her tobacco use? She definitely has the motivation to start. So as your provider, you could say, it sounds like you're really excited. There are different ways that I could help you quit. Would you like to hear about some of those ways? What medications might you suggest? Chantix? Anyone else? Patches, great. Chantix is a great option because she is a really heavy smoker and she has been smoking for a really long time. The patch is also great. She would have to use the highest dose, and it would be recommended that in addition to the patch, she also combines it with the short acting, such as the gum and the lozenge. The whole idea with the patch and the gum is that, especially if you're a heavier user, the patch gives you a consistent release of the nicotine throughout the day, but you might get those random little cravings. It's almost the behavioral piece. So that's when you would take the gum to try to help alleviate those triggers throughout the day. Does that make sense? Yeah, that's a great question. So ultimately, the real harm in tobacco products is the tobacco. So by switching over to the nicotine, you're helping alleviate so many different negative health benefits, cancer, coronary heart disease. It affects every part of your body, fertility, etc. So by switching over to the nicotine, it's a harm reduction approach. But the whole idea with the patch too is that you would start, there's 3 doses. There's the 21 milligram patch, then the 14, and then the 7. And especially with a heavy user, you would start with the 14. They would use that for a few weeks, and then they would lower the dose to 14. So the goal ultimately is to try to wean them down or off entirely. Not in comparison to the tobacco. Nicotine has been known, especially in younger people, it can kind of alter brain chemistry and potentially affect brain development. But in comparison to the negative consequences of tobacco, it's definitely the preferred method. Yeah. Yeah, no, did everybody hear that? So sure. So the question was, what are some ways that we could address Christine's tobacco use? And one answer could potentially be thinking about that alcohol use. She says that alcohol is one of her triggers for smoking. So she's drinking 3 to 4 times a week. So potentially talking to her about quitting or reducing the amount she drinks could also help reduce the amount that she is smoking. So talking through that is definitely a good option. And we'll have just other health benefits as well for quitting or reducing the amount that she's drinking. That's correct. Yeah, so Chantix is the medication. It's the most effective form of treatment. And the New York City Department of Health actually recommends that no matter how interested someone is in quitting, if offering them a prescription to any of these medications, but especially Chantix, can be helpful because they might fill it, and it's just scientifically been known to be the most effective form of treatment. But you should not use the nicotine replacement therapies such as the patch, the gum, the lozenge with it. Yeah. Honestly, I do not know the science behind it. The whole idea of Chantix is that it's basically reducing your desire for the nicotine and like the dopamine effect. So I think it would just have a negative kind of consequence of not, I don't know, prolonging it. I'm happy to send more information though. Any other thoughts for Christine? So it's great that we all mentioned the medication, but the missing link is the counseling piece. So as a provider, it's really important that you are thinking about addressing the behavioral change component. So I would recommend referring her to some type of behavior change program. You might have social work, psychology, psychiatry in your building, so you can refer them internally. There are other programs that are free that you could refer them to externally, such as the one across the street at Health and Hospitals. Also referring her to the New York State Smokers Quit Line could be a great option as well, so she could get a few counseling sessions and talk through her quit or reduction journey. One more case study. So in this case, Alex is a 22-year-old. He is seen at a student health center at a university. And he started vaping 2 years ago, and he uses his e-cigarette 10 to 15 times a day. He vapes within 10 minutes of waking up, and he uses vaping to manage his anxiety. He's tried once to quit, and he tried quitting cold turkey, but it made him really irritable, and they had a hard time concentrating. He wants to quit, but doesn't know how or where to start. He has a medical history of depression and anxiety and takes Lexapro. His social history, he's single and he's living on campus housing for school part of the time and at home the other part of the time. He attends class 5 days a week. Vaping is not permitted in classrooms and other campus buildings, but you're able to use cigarettes in these settings without getting in trouble. That doesn't actually make sense. So let's just assume vaping and smoking e-cigarettes is not allowed in the building, which is the case for most places. Apologies for that. Alex does not use drugs and drinks 4 to 5 times a week socially. His motivation to quit, he doesn't like the way it makes him feel and wants an alternative to managing stress, and really wants to focus on school, but alcohol and stress are some triggers. So, what are some ways that you might help treat Alex? Could you repeat that? Therapy or counseling, definitely, especially with that medical history of depression and anxiety. That's a great idea. So the Wellbutrin is something that is known to help with smoking cessation, and it's also an antidepressant. So it could be a really great drug for them because it would help address both of these issues. That's great. So the idea is to counsel Alex on other ways to handle stress, because stress is one of the triggers, so thinking about diet and exercise, etc. Another thing that I think is worth mentioning is a lot of people have to either work in smoke-free buildings or they live in smoke-free homes or smoke-free environments. So in New York City, public housing is smoke-free. So you actually have to leave the building, and I believe you have to be at least 25 feet away from the buildings. So it can be really stressful because you have this, physiological dependence on using tobacco products and the nicotine, but you have to be constantly leaving and getting cravings in your own space. So that can be a great motivator to help people quit as well. That makes a lot of sense. When I was reading it, I got confused, but it's true. We work at NYU, and it's a smoke-free campus, right? And the library's smoke-free, but people are vaping everywhere, and it's not enforced. So it's actually really challenging. It's something we hope people will find ways to address. Yeah, that's a good question. So it's basically, are e-cigarettes as dangerous as tobacco products? So there's a lot of emerging research. So because e-cigarettes have been on the market only in the last 10-ish years, they're still doing these long-term studies to see the ultimate health effects. So there's unfortunately actually not tons of research on it, but there are a few things to note. So some of the chemicals that are found in tobacco products are also cancer-causing and found in e-cigarettes. So that's number one. And number two, we know that it does cause a lot of different lung problems. If we remember a few years ago, so many teens were getting hospitalized because of the vitamin E that was in e-cigarettes. So of course, tobacco companies have now removed the vitamin E, so people still use them, but they can have negative health effects that way as well. My other thing that I would note is that the New York State Smokers Quit Line could be a good option for this person because they would get those 5 counseling sessions because they would report some type of psychological distress. So that would give them extra support to help them quit, as well as potentially the free patches, gum, etc. Any other thoughts or questions? Okay, so to summarize, pharmacotherapy is an effective way to assist in someone's quit attempt, and if they are comfortable having a conversation about it, you should definitely encourage them to use medications because it is the most effective way to help them quit or reduce the amount that they are smoking. It's also really important to address the behavioral triggers to support a successful quit attempt. There are robust referral resources for your patients, including the New York State Smokers Quit Line. New York City Department of Health also has tons of resources for healthcare providers. We put some on the back table, and we really encourage you to look. Camilo mentioned these. This little pocket guide is great. You could literally talk through different medication options with the patient, and it explains instructions, how to use it, etc. Especially with things like the patch, like all of these different medications, but things like the patch, it's really helpful to actually talk with your patient on how to use it so they do it effectively. So like if they're taking the patch off in the middle of the day and then they tell you they're not able to quit, you can then pinpoint why. So this is great. And then also the how can I get tobacco treatment medications is a great one. A lot of different insurance company or insurance providers will actually cover even some of the over-the-counter products like the patch, et cetera. So Medicaid covers all 7 of those tobacco cessation medications, which is really important to note. Motivational interviewing oh, yes. Are patients able to get free patches or gum? So a few things. So the New York State Smokers Quit Line could send your patients free patches or gum, so you can refer them directly to the Quit Line. You can actually submit information on their behalf, or you could work with them and have them call the number. Then they could get sent free patches. So that's 1. 2, if they have certain insurance providers, their insurance might cover it for free. So you should try to write a prescription for them, and then they could theoretically get a patch, the medication's free. And then finally, we have provided a really limited amount of nicotine replacement therapy, like the patches, to the Ancaster Free Clinic. So that's another option as well. When you're engaging with someone who uses tobacco, prioritize expressing empathy and offering support. And finally, encouraging people to quit or reduce the amount of smoking that they smoke can significantly improve their overall health. So with that, that's all of the questions we have. We have a survey for you to just provide any feedback. I'm happy to stay and answer some questions if anybody has any. But thank you so much for coming and attending this presentation, and we appreciate your work with all of your patients, helping them quit.